So we're just going to do an orientation for the LifePak 12. First thing you're going to want to do is just turn it on, the on button, and then check for the batteries that they're full. So right now it's saying that the second battery is like 1 bar already done, but the first battery is full. If you do want to change the batteries, all you have to do is just behind here and you just push it out, take it out, and then change it. And then push it back in.
Connect electrodes.
Alright, so now we're just going to want to put it into manual mode, and all we do that for is just select energy select, sorry. Turn it over to yes. We're going to put it down to 50 joules today for testing it. Just like that. Cool. And so the next thing that we're going to do is we're just going to do a user test, and so all we have to do that is just press options, turn the dial to user test, and we'll just wait for it. Cool, so that says that the user test has passed. I noticed that the paper is running low because of the red line, so there's usually paper left in the back, which there is, so we're just going to replace that. So all you're going to do is just pull this little lever, and yeah, super empty. So we're just going to shove that in. Oops. Make sure it's not jumbled up like I just did it. And then push it back in. Cool. So now we're just going to do a defib test, and all we're going to do for that is just take the test load out with the wire and just attach it like that. Just leave it there. It is live energy, so just be careful. So all we're going to do for that is just hit charge. Let everyone know that you're doing a shock and to stand back. Deliver the shock. Energy delivered. We're going to do it again. But this time I'm going to disarm it and just hitting that button there. Now I'm just going to change it back to AED, and all you have to do for that is just press advisory. So now it's in that mode, which is fine. Now normally I would attach the leads to somebody, which I've already done, so all we're going to want to do is press the lead button. There's a couple different options, so we're going to change it to 2, 1, and 3, just like that. Now I'm going to change the QRS sound, so all we have to do for that is just go over to heart rate, select that, select it again, turn it up to about halfway, press home button, and now we're just going to change the amplitude of the ECG, so the size, so we just press size, and we're going to go up to 2.5, select that, and it should change it. Cool. And then so normally if I had wanted to take a blood pressure, we have a blood pressure cuff in the back. I would get consent from the patient, put it on their arm, give them a little warning that it will be a bit tight, and then all we want to do is just press the non-invasive blood pressure button and press that, and then it'll take their blood pressure. I'm not going to do it obviously today because there's no patient. And then the last thing that you're going to want to identify is the ETCO2, which is just right there. And then you have your little wiring in the left pouch, and all you do is you can attach that, get your patient to blow in it, and it just gives you their CO2 levels. Okay, so now I'm just going to take Rachel's respiration rate. We're just checking for equal rise and fall of chest, words per breath, work of breathing, and to make sure that her respiration rate is normal. A normal one for an adult is 12 to 20 breaths per minute. Usually you need to gain consent, but mentioning the respiration rate to a patient can sometimes interfere with their normal breathing. So Rachel, if you don't mind, I'm just going to take your pulse again, if that's okay with you. I'm just going to take it in a different position though. Cool. I'm just going to put it across your chest. So you can just put your arm down. So I ended up getting 4 breaths per 15 seconds, and so all we have to do there is just times that by 4, which means 16 breaths per minute, and that's completely normal for the age that you are and at rest. Okay, so today I'm just going to take Rachel's heart rate. In order to do this, I'm just going to take 2 fingers and place them on the radial artery today. All I'm going to do is count that for 15 seconds and then times that by 4 when I'm done. What I'm doing is checking for regularity, the speed. So if it's fast, that's tachycardic. If it's slow, that's bradycardic. Also, if it is irregular, so if it's weak or strong, you just take that for 30 seconds and then times it by 2. So Rachel, if you don't mind, I'm just going to take your radial pulse.
Yep, that's fine.
Perfect. So she ended up getting 16 beats. So we just times that by 4, which is 64 beats per minute, and that's perfectly regular because you're at rest, and that's regular for your age as well.
Cool, thank you.
So today we're just going to take Alicia's blood pressure. Alicia, have you ever had your blood pressure taken before?
Yes.
Yes. Okay, so you know that we need to put the blood pressure cuff on your arm and everything. Might feel a little uncomfortable and tight, but it shouldn't hurt. Yep. So first thing, I did get her consent, so all we're going to do is just feel for her brachial artery. Yep. So now we just pop this on. We just put where the artery is, where we just felt. Make sure it's nice and tight and not too uncomfortable. Is that all right? Mm-hmm. Yep. Perfect. And then all we're going to do is just pump it up so that we can no longer feel the artery, and just pump it, 1 pump above that. Perfect. So now we're actually going to take it and just place this under where the artery says. Perfect. So your first reading, which was your systolic reading, which was 110, and then your second reading was 70, which is your diastolic reading, and that's perfectly normal and in the range for being an adult. Today we're going to do some wound management. We're going to do a bleed. So the first thing when you come to this is you just need to expose the wound fully. So Rachel, if you don't mind, I'm just going to lift up your shirt to see the whole wound. Just like that. Sweet. So what you want to do now is just clean the wound from the inside out, and all you do for doing this is just take some saline water and pot it on a bandage, and then just clean from the inside out. Cool. And then you just want to get a bandage that is smallest that you can get. Put some water on it so that when they take it off, it's easier to take off. And then so Rachel, all I'm going to do is just get you to hold that there for a second. Cool. So then the first thing you're going to want to do is just make sure that you anchor the bandage from top to bottom, just like so. And once you feel that's ready, then you can start twisting, so high pressure. How's that? Is that all right? Yeah. Perfect. And then you can just set it down with some tape. And then so Rachel, I'm just gonna get you to hold it up there just to release some of the pressure. The next thing that you can do is take another bandage and apply some indirect pressure by just putting it underneath the arm. So Rachel, if you don't mind, I'm just gonna pop up your arm just like that. And if the bleeding doesn't stop from there, you can now use a tourniquet. That can suggest that there is a catastrophic or arterial bleed. All you do for this is just open it up a bit, get the person to put it on their arm. So I'm just going to put this on your arm, Rachel, if that's all right. And you're just going to want to apply it 10 centimeters above the wound or away from. Make sure that it's nice and tight. And then all you're going to do is you're going to just twist this until you feel no more radial pulse or the bleeding arrests. The next thing that could happen, you might need to use a second tourniquet. For that, that's fine. You just need to make sure that you document the time every time you put one on. So when you're delivering oxygen, you just have to make sure that it's actually oxygen. And you just check this at the beginning of every shift you go to as well. So just to identify it, make sure that it's the white cylinder and that it says O2 on it, which it does. So when we deliver oxygen is when the person's SpO2 rate is less than 94%. They're short of breath, they're hypoxic, they either have cardiac or respiratory arrest, they're in shock, they have a TBI, a low score on the GCS scale, or they have smoke or toxic gas inhalation. Today we're just going to be demonstrating with a nebulator and the tubing. So all you're going to want to do is just make sure that the regulator is the correct one for the oxygen, and basically there's like kind of keys that go into the lock to make sure that it's the right one. You just have to make sure that the O-ring is intact and that it's not cracked, and it's not, so that's fine. We can just pop that on. Okay, so then when you're tightening it, you just tighten it a quarter, just like that. And then now you just check that there's actually oxygen in it, and all you have to do is just turn it on, and there is. So now we just take the end of the tubing and we just pop it on the bottom, make sure that it's just nice and tight, and then make sure that your flow rate is at the desired number, and we're just going to use 8 today. And so all you're going to want to do for that is now just turn it on. You see it flowing out, and now it's safe to administer to your patient. You don't want to turn it on with the mask already on. So what you have to do, just pop that off, and then just to flush it out, just like that, and then just lay it down for safety. So when you are delivering oxygen, you just want to make sure that the reservoir bag is intact and there are no leaks. So all you have to do is take the mouthpiece off, put the bag on like that, and inflate it up. So yeah, that's fine. Put it back on. Put the mouthpiece back on. And to ensure this, you just need to make sure that the head, the airway is open. So you just by doing a jaw thrust or a head tilt, just like that. You can put a towel underneath like that. So now that it's open and clear, you can now place the mask on with a C-grip, ensuring that it's sealed, and you can just look for a chest rise and fall, just like so. You want to make sure that the oxygen flow rate is 10 to 15, and if your patient has reached ROSC, then that means you can ventilate every 8 seconds. If you're finding it too hard to do it all on your own, you can always ask for a second person. All they're going to do is just put their hands around the mask while you ventilate, just like so.